After penile implant surgery, you will always be given some form of pain medication, and if that's not adequate, we will work with you on finding a way to better manage your discomfort. In general, we try to reduce swelling by leaving a drain in after the surgery. And as long as the drain is adequately emptied and removed by our nurse on post-operative day 1, patients do have a very limited amount of swelling. If there is excessive swelling, certainly wearing tighter fitting undergarments and sleeping with the scrotum elevated can reduce some swelling. The incision site does need to be kept dry for 48 hours and covered with a dressing at least for 24 hours. We don't need any ointments or creams applied to it, and I would discourage you from bathing or submerging for at least a week. But showering is generally okay after 48 hours. As soon as there's enough comfort where you can tug down on the pump in the scrotum, we do encourage you to tug down on the pump so it settles in the most dependent or lowest portion of your scrotum, which makes the pump easy to access in the future. In general, we try to provide non-narcotic pain medication to reduce the risk of constipation, though if you do get constipated, staying well hydrated helps, along with taking over-the-counter stool softeners. We don't want patients to do any heavy lifting for 3 to 4 weeks after the surgery. Submerging in a bath, I would wait at least 1 week, but keep it dry from showers for about 48 hours. Depending on what you do depends on how long you need to take off from work. Physical jobs, I would try to at least get 2 to 3 weeks off, especially trying not to do any heavy lifting or exertional activity for 3 to 4 weeks if possible. But if you do have a desk job or you work from home, you can certainly return to work as soon as you're comfortable to sit in front of a desk. We certainly don't want anyone using heavy machinery or operating a vehicle on narcotic pain medication. Recovery can vary patient to patient. Some are comfortable after 1 to 2 weeks. Some men it takes a little bit longer to get comfortable enough to resume normal day-to-day activities. In general, if there's any signs of infection, which would be fevers, chills, increasing redness around the incision, or swelling that's getting worse after the first 24 to 48 hours, that would be something we would want to know about. Or if you're having exceedingly high levels of pain that are not controlled with oral pain medication, we would like to be made aware. The day after your surgery, you will have to make an appointment to see our nurse practitioner, which we will try to set up for you before you leave the surgery center. And I like to see my patients post-operatively about 3 to 4 weeks after surgery. In general, we allow men to start inflating and deflating the device about 4 to 6 weeks and resuming sexual activity in that range. The best person to contact after surgery would be my office staff, primarily our triage nurses or our nurse practitioners. If they cannot answer your questions, they can reach out to me and I can reach out to you, or I can relay the answer to them.